Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte fires more government officials involved in corruption but admits he has no jurisdiction to investigate Congress and members of the judiciary. A group of nurses asking government to heed urgent appeals of thousands of healthcare workers still unpaid amid the fight against the coronavirus. And a lawmaker is renewing her call to probe the contract in the 2019 SEA Games venue. Senator Risa Hontiveros joins us live. President Rodrigo Duterte spoke of the government's fight against corruption once again. In his speech on Monday evening, Mr. Duterte mentions the names of alleged violators from the Bureau of Internal Revenue. He also says he received a list of congressmen linked to questionable transactions, but he did not read out their names, saying he has no jurisdiction to investigate lawmakers. Here's the president in his own words.
I have no other recourse. Itapon ko rin yan doon sa ombudsman because it is the only investigating agency that has jurisdiction over congressmen. Hindi ako. I cannot investigate congressman. That would be an encroachment of the power of the separation of whether dito sa akin i-mention ko yung pangalan o hindi. Kung wala akong jurisdiction, I'm not trying to wash my hands. I am now dwelling on the law. If I cannot investigate the congressman for itong mga kickback nila sa mga komisyon, sa mga projects sa kanilang probinsya na pinili nila yung mga...
In other news, the government now allows nurses and other medical workers to leave and work abroad again. A group of nurses says they welcome the move but appeals to lift this 5,000 yearly cap. Nurses are also reiterating their call for the timely rollout of salaries and other promised benefits, including hazard pay, and special risk allowances. Let's go straight to the source of the story. We have Senator Risa Hontiveros. Senator, good to have you back on the source and maraming salamat po sa inyong oras.
Salamat din sa pag-iimbita.
I want to start with what the president said last night, maybe just a quick reaction from your end. The president said that about hundreds of officials and employees have been dismissed due to corruption. Are you satisfied with this so far, with the government's fight against corrupt officials?
Well, I think it's an ongoing work, Pinky. Yung aming pagtingin sa pastilla scam at saka yung visa upon arrival. At last but not the least, yung outbound trafficking and prostitution ay kukumpletuhin pa lang namin sa Senate Committee on Women, Children, Family Relations and Gender Equality. Mabuti at nagpapatuloy yung sinasabing all-out campaign against corruption sa iba't ibang mga ahensya. And I say mabuti ito, Pinky, because that was originally one of the president's campaign promises 4 long years ago. And we still need to see the concrete conclusion of that.
I want to move on to the plight of our nurses. Of course, government has finally lifted the ban on the deployment of healthcare workers going abroad, saying Secretary Roque was saying yesterday that the reason for this is that the declining number of cases here in the country.
I can't hear you.
And because of vaccine. All right, Senator Risa, let me try again. Can you hear me now?
Now I can hear you. Thank you.
Okay, perfect. So I wanted to talk about the plight of nurses. I do remember, of course, you were the chairperson of the Committee on Health way back. So ang sabi ng gobyerno, lifted the deployment ban on healthcare workers going abroad. Ang sabi ni Secretary Roque, there are two reasons for this. One would be the declining number of COVID-19 cases in the country, and the other is that there's a vaccine coming in the offing. Do you agree, Senator, with this 5,000 cap that they imposed on healthcare workers leaving abroad?
Well, I'm glad you asked me the question that way, Pinky, kasi, well, una, matagal na nating hinihiling na i-lift yung travel ban laban sa ating mga nurse at iba pang healthcare workers. At sa wakas, napakinggan na rin sila, napakinggan tayo. I'm very glad about that. Pero this is not the end of the story. Itutuloy dapat natin yung trabaho na mailagay sa ayos yung kanilang working conditions, compensation, at saka protections under the law. And yun na nga, yung 5,000 cap, siguro bago natin lagyan ng anumang limitasyon o ganyang cap, ayusin muna natin yung working conditions nila. We know, for example, Pinky, that there are still about 16,000 healthcare workers who have not received their hazard pay, especially in the face of their added responsibilities during this COVID-19 pandemic. So ayusin po natin lahat iyon, their working conditions while here, working locally, at yung karapatan din nilang magtrabaho sa ibang bayan. I mean, our healthcare workers, our nurses included, deserve better.
I'm glad you said that because I had an interview with Filipino Nurses United yesterday, and that came up during a hearing, I believe, in the Senate. It was the DOH, allegedly, that said there are about 16,000 healthcare workers who may have not been paid their salaries the past 2 or 3 months, may have not been paid their hazard pay, or may not have been paid their risk allowance. I guess what I want to find out, Senator, is why is this happening? If you were to work, you would want to be paid for the work that you're doing.
Exactly, Pinky. Even under non-COVID conditions, karapatan yun ng ating mga nurse at iba pang health workers, di ba? Lalo na ngayon that we are facing an unprecedented pandemic, we have thousands of healthcare workers who've already gotten sick and died from COVID-19 while taking care of us Filipinos. Pinapagaling nila tayo mula sa COVID, nililigtas nila tayo sa kamatayan dahil sa coronavirus na iyon. So it shouldn't be the case that placing themselves in the line of fire of COVID-19 na sa kanila pa tayo magkukulang bilang isang bansa o kami bilang gobyerno. So those benefits due 16,000 are due immediately, and please, i-lift na rin natin. Kung i-lift na rin natin yung travel ban, huwag na tayo maglagay ng cap pa na 5,000.
So let me follow up on that, Senator, because sinasabi po nila umaaray na sila at they have been trying to talk to legislators about this. Hindi sila nababayaran, walang risk, walang hazard pay. What can the Senate do regarding the plight of our nurses? Doon sa hindi nabayaran, walang risk at walang hazard pay.
Well, once again, yung pag-aray at pagdaing ng ating mga healthcare workers is very timely, Pinky. At the Senate, we are in the process of moving into amending the proposed 2021 budget. At isa sa pinaka-importanting tinignan talaga namin ay yung tamang dapat na budget ng Department of Health. And we know that one of the most important pillars of any universal healthcare system is our health human resources. So bibigyan talaga namin ng karampatang pansin yung budget para sa ating mga healthcare workers in 2021, which means nakataon din kami sa dapat na compensation nila ngayon at ngayon din, because those items of hazard pay, etc. are due in the current year 2020.
Yeah, but that's my question, Senator. Nakapaloob na po yun sa 2020 budget. Bakit hindi nila nakukuha?
Exercise ng oversight power or function ang Kongreso. Kasama na kami sa Senado. Whenever we consider passing a budget for the following year, sinisingil namin yung agency tungkol sa paano nila ginagamit ang budget nila sa kasalukuyan. We have not only, Pinky, the 2020 budget, but also the Bayanihan 1 and 2 laws that
Bayanihan,
we passed. Yes, specifically to address our additional budgetary requirements dahil sa COVID-19 pandemic. At siguradong nandun itong mga hazard pay ng ating mga nurse at saka healthcare workers. So no excuses ang DOH at ang buong gobyerno na hindi ito ibigay sa kanila ngayon din. They should not even have become month spending as is the case now.
So definitely, sisingilin niyo po sila hinggil dito.
Sinisingil na, Pinky, and we will make sure that before the year is out now, I mean, my God, we're a month before Christmas Day. This situation should not have arisen in the first place. So utang namin yan, utang ng gobyerno yan sa mga healthcare workers ngayon din.
Kailangan daw ng 73 billion pesos in loans to be able to administer the COVID-19 vaccine to 60 million Filipinos. I wanted to know what your thoughts about this. Pwede ba tayong kumuha ng pera, dagdagan natin yung budget para sa vaccine so we don't have to borrow money? We're gonna talk about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Senator Risa Hontiveros. The president and his cabinet also talked about the vaccine. And we're looking at least the finance secretary, I believe, is looking at 73 billion pesos in loans for 60 million Filipinos. Two questions first on this, Senator. How much is going to be budgeted for the vaccine? Last I looked, it was about 15 billion, if I'm not mistaken. And are you okay that we borrow the rest, or must the Senate and the House look into tapping money from other agencies and put this to be able to buy more vaccine?
Well, actually, Pinky, I'm glad that the executive, through the Department of Finance, has finally come up with a proposed amount that they say we need in order to vaccinate more than half of Filipinos, at least in the first wave. Because when we started considering the proposed 2021 budget, ang liit ng budget item para sa vaccines. At the very first instance, it was only 2.5 billion pesos. Tapos tiningnan nung aming Senate Finance Committee under our chair, Sonny, dagdagan ito ng at least 8 billion para the running total now would be at around 10.5 billion. Kung tina-target ng executive na 7 times that, then that's a welcome development na mas klaro na yung target namin. Now, as to the sources of the funds, of course, kahit anong gobyerno naman pwedeng may component niya ng utang, and we have these even since Bayanihan 1 and 2. Pending pa nga yung resolution ko for a special COA audit on the spending of these loans plus donations and the budget itself for Bayanihan 1. Pero your question is correct. There are other possible sources, if not to totally eliminate, then to minimize yung loan component. Halimbawa, yung isang tinitignan namin ngayon sa Senado ay yung mga iba't ibang pondo na nakapark sa iba't ibang government agencies na inuungkat ngayon, where we are digging out those small and not so small amounts and pressing the executive, saying na gamitin natin ito sa mga urgent COVID-19 needs natin sa ngayon, lalong-lalo na yung vaccine.
And if I'm not mistaken, Senator, it was you that proposed a budget to tap some of the budget of the NTF-LCAC. And was it to put it to divert it to typhoon victims, or possibly pwede ho kaya sa vaccine?
Posible yan, Pinky. I propose that the 16 billion peso LCAC fund, which is supposed to go to cleared barangays, minungkahi ko na mga kalahati nun o 8 billion ay idagdag sa masyado pang mababang budget ng Department of Health. Halimbawa yung 2 billion sa kulang ng ating mga national at regional public or government hospitals, lalo na sa gitna ng COVID. And I join with my colleagues who say also that that fund of the LCAC could be added instead, for example, to additional housing. Lalo na ngayon, Pinky, pagkatapos ng tatlong sunod-sunod na bagyo, may inaasahan pa tayong 4 before the year is up, because of the terrible effects on our people and the urgent need, not just for temporary but for permanent housing. At tama ka, pwede ring idagdag kahit bahagi ng LCAC budget na iyon sa ating pot na binubuo para sa vaccines.
But do you think you will have the support of the senators and be able to tap some of the funds of NTF LCAC to any other agency, be it the DOH or even for housing?
We're still striving mightily, Pinky, as we enter the period of amendments to convince a majority number of us to do that. So hindi ko pa masisigurado sa iyo sa ngayon if we will be successful. But I think around the table at the Senate, klaro naman sa bawat isa sa amin the great need and the gap that there still exists, particular sa ating health budget for 2021. Dahil hindi lang ito ordinaryong taon during which patuloy nating gustong i-implementa yung Universal Healthcare Act, but the single most impressive fact of our lives today, the COVID-19 pandemic is still very much upon us. At gusto namin na yung 2021 budget natin maging COVID responsive, plus maging typhoon responsive.
Very quickly, have you heard, is it true na si Senator Ping Lacson ay na-vaccinate na po? Natanong niyo ho ba siya?
Hindi ko siya natanong dyan. So, hindi ko pa narinig kung totoo yan o hindi.
Do you have any issue with that in the event that it's true?
Oh, if it were
Kasi
true...
sabi ni SB Soto, it's a personal choice.
Well, and given that, if it were true, siguro ang una kong itatanong lang ay, safe po ba? Walang side effects? So ganon, yung concerns about the safety and efficacy of any such vaccine, kung totoo man yung kwentong iyon.
When we come back, we're going to talk about the privileged speech of Senator Risa Hontiveros looking into the facilities in the New Clark City that was used for the SEA Games in 2019. She has a lot of questions about this. We'll talk about that after the break. Welcome back to The Source. Senator Risa Hontiveros wants a probe on the sports facilities at New Clark City that was used for the 2019 SEA Games. Trying to understand it is that the senator is actually questioning this joint venture agreement between BCDA and Malaysian firm MTD Capital Berhad. Yung concern mo, Senator, is that ang MTD Berhad built the facility for 9.5 billion pesos, pero ang ginamit nilang pera para gawin ito ay inutang sa DBP na babayaran ng BCDA na kinuha or kukunin sa budget natin. So, tell us more about this.
Actually, Pinky, kinuha na sa budget natin, sa buwis ng ating mga mamamayan noong 2019 kasi ipinasok yung item na iyon sa General Appropriations Act o yung national budget. So, pinalabas nilang joint venture agreement sa halip na halimbawa sa ilalim ng Build, Operate and Transfer Law na sinabi ng COA at ng OGCC na mas appropriate. At dahil pinagmukha nilang joint venture, ay hindi na nila kailangan dumaan sa public bidding. Pero kalaunan, yun na nga, yung pambayad sa utang na iyan ay hindi naman talaga ibinayad ng BCDA doon sa private sector counterpart nila. Kinuha sa Development Bank of the Philippines, isang government bank, and then binayaran kalaunan, yun na nga, sa budget. So parang tayo-tayo lang mga Pilipinong ahensya pala ang nag-transact dyan. Isang GOCC, isang government bank, and then yung budget ng national government. So in common sense terms, parang hindi talaga siya joint venture. So kung hindi siya joint venture, Bakit hindi na lang gobyerno from the very start ang nagsagawa ng proyektong ito? Hindi na parang nangyari kasi ginisa tayo sa sariling mantika ng BCDA.
And why didn't we just build it on our own?
Exactly. If it was going to be built on government land, overseen by a government-owned and controlled corporation, funded by a government bank, kalaunan nandun sa national government budget, di ba? Ba't hindi na lang straightforward mula sa simula, government project?
But is it possible, Senator, that we needed the expertise, possibly, of this Malaysian firm?
Possibly, we needed their expertise. Apparently, they're a company of long-standing. They're well known for their expertise in these kinds of projects. Hindi naman yun yung tinatanong ko eh. Hindi rin naman tinatanong ko kung maganda ba ang facility, world-class ba ang facility. Lalong hindi ko tinatanong kung deserved ba ng ating mga pambansang atleta ang ganitong mga facilities. Definitely. And I said in the interpellation na untarnished ang striving nila, ang efforts at yung tagumpay, yung karangalang dinala nila sa ating bayan through their medals. Ang tinatanong ko lang, Pinky, ay yung propriety nitong buong kontratang ito at itong buong proyektong ito.
Because at some point, nagsalita din si Senator Pia Cayetano, and then you had to clarify that this is not about the athletes. This is not even about, this is still, of course, honoring our athletes for a job well done. But there's also a question that you raised on the manner or the speed by which this loan was approved.
Yes. Lightning speed, Pinky. Pwede kang magkaroon ng whiplash. The loan agreement was signed in February, late February, I think the 28th. And then lumabas na kaagad yung utang, 9.5 billion pesos, not a small amount, 21st of March. So 3 linggo lang, ni isang buwan. So ganun kabilis, no? Na hanggang ngayon, hindi pa malinaw ano yung collateral that was put up for such a large amount, ano yung magiging cash flow ng proyekto pagkatapos. Bakit hindi ganun kabilis makakuha ng utang para sa ibang government projects, no? For example. So the rapidity also of the transaction really invites questioning, and I feel very reasonably deserves clarification. The fact, Pinky nga, na finlag na yan ng COA, finlag ng OGCC, means it is reasonable for the Senate to also look into it.
Senator, very quickly, I have 30 seconds left. Do you have the support of senators to be able to conduct this probe?
Slowly, more and more have been speaking publicly. I'm very glad and grateful about that. So I look forward to that hearing and to subpoenaing the relevant documents, starting with the loan document itself.
And Congressman Cayetano was saying they're also open for this probe. However, if it is found out that mali kayo, lumalabas po yung mag-resign kayo.
Well, I've always said from the beginning, this is not about politics. This is about accountability. At with all due respect, hindi ko naman sila binanggit at all sa PRIB speech. Sa pagkaalam ko, hindi sila bahagi ng BCDA ni ng DBP. So it is those two agencies and their officials that I would have my eye on in the hearing. And I fully intend to practice interparliamentary courtesy between the two houses. So I'm not calling his challenge or his bluff. Kasi may nagsabi nga pag hinihingi natin halimbawa sa ating opisina na mag-liquidate tayo ng expenses, sinasabihan ba natin yung humingi no na mag-resign ka pag tama naman yung liquidation ko? So this is in the full exercise of Congress's, including the Senate's, power of oversight over the spending of public funds. Yun at yun lamang. Alang-alang sa ating mga atleta, alang sa ating mga taxpayers.
Senator Risa Hontiveros, ma'am, maraming salamat po sa inyong oras.
Maraming salamat, Pinky. Ingat, stay healthy.
You too, thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.